Welcome back to another episode from the Optimal Body Podcast. I'm Dr. Dom.
I'm Doc Jen.
And today we're going to be talking about the rotator cuff, specifically rotator cuff injuries and tears. What do the treatment protocols look like? How good are the outcomes? And really, what should you do? So I feel like the rotator cuff is so commonly talked about when it comes to shoulder injuries. What can I do to strengthen, improve my rotator cuff? Or what can I do if I have a rotator cuff injury? We're going to get into all that. But before we do, please comment below. Have you had issues with your rotator cuff, with your shoulder? Let us know. A lot of these episodes come from exactly what you request and recommend we make videos on. So we want to know what you want to know. Please hit the notification bell and the subscribe button before you go on, because we have so many of these videos and we don't want you to miss out on any of them.
We have done a podcast episode actually a long time ago when we first started this podcast. So we just want to revisit it, maybe bring up a couple new research articles that are come out and what you should know, but really provide you with the exercises that we think you should be focusing on when you're going through your rehab protocol.
So first of all, what is the rotator cuff? We talk about it as if it's one thing, but the rotator cuff is actually four muscles. Often we'll call them the sits muscles, sits plural, because it's the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Not that you need to remember those, but essentially what these four muscles do are, their primary actions are to externally rotate the arm, internally rotate the arm, and help with initial elevation of the humeral head, or this big long arm bone that we have when we flex our arm overhead. Those are the main actions, but as they work together, one of their main purposes is to keep the humeral head centered in the socket. It's a ball and socket joint, and often when a lot of our other big muscles are pulling on our arm, it wants to tug around on that humeral head, and the rotator cuff muscles are good at helping keep that centered in the joint.
Yeah, and because we don't have like a lot of muscles underneath necessarily, or we have a lot of our ligaments, tendons, everything is kind of crossing the front, back, and top of the shoulder, those rotator cuffs are really playing a role in your shoulder stability. When we think of rehabbing our rotator cuff, then we're looking at what are the stability exercises that I'm going to use to help my shoulder. And though we agree there's a lot of great stability exercises that kind of progress in the overload of strengthening those muscles, we also want to look at the bigger picture and why might that be happening and what more can we do. So we're going to really be talking about that. But when it comes to like kind of feeling that rotator cuff injury, this is where it can is it impingement? Is it supraspinatus impingement? Is it just irritation of the shoulder? A lot of times we say that it's within this painful arc, right? Maybe our shoulder blade isn't moving quite as nicely with our entire shoulder, and so we get this pinching sensation. I would not correlate this with cracking and popping necessarily that you're hearing if that is not associated with pain. We've done, I believe, an episode on shoulder cracking and popping before, but in general, joint noises are totally normal, especially, we just have so much going on around the shoulder. So don't think of that as rotator cuff injury pain. We're looking at symptoms. We're looking at the symptoms of pain that you're feeling traditionally with exercises, usually with overhead exercises or overhead reaching for something, or just trying to lift your arm forward or out to the side. That's usually when we're getting those symptoms of rotator cuff.
I tore my rotator cuff. What does that even mean?
Mm-hmm.
There's four muscles. Often when we're talking about injury or tearing or impingement, the one that gets brought up the most is the supraspinatus muscle. And there's if any of the muscles are damaged, there's all the different degrees of the rotator cuff tear as well. Really figuring out exactly what is torn, what grade or what level is the tear, and then how do we approach it? That's a big component to figuring out the best course for rehab. I've actually torn a rotator cuff muscle before, funny enough. and based on some of the research we talk about, I wouldn't be surprised if we imaged both of my shoulders and noticed that I have tears of some sort in my rotator cuff muscle. But when I did it, and this is very common for people who tear it, I was skipping rocks at the North Shore, Lake Superior in Minnesota with a friend, and I was just kind of flicking and throwing these rocks sidearm, just nonchalant, not worried about what I was doing. And I threw it at my arm. It was so weird. I threw it and my arm just went dead, across my body. And I was like, oh my gosh. And immediately couldn't couldn't even lift my arm, very far away from my body. The next day or even that night, like not thinking, I went to like try and get something out of the fridge and just had that really sharp pain in the front of my shoulder. I ended up getting an image, and they said on the MRI, when there's tears in a tissue, it doesn't spell it out for you and say tear or torn rotator cuff. It appears more as like what they call interference. So the tissues don't look super smooth. The light, or essentially what the machine is showing in the picture, looks kind of scattered. And they said, well, based on what we're seeing, there's a lot of interference here. You probably have a tear in your rotator cuff. But yeah, I didn't do anything other than conservative treatment. At that point, I wasn't even a physical therapist. I didn't know I was going into this. This was before college even. And yeah, got back to full activity, full everything. Haven't had any major shoulder issues since then. There was a study that looked at people over age 50, and between 20 and 25% of people can have a partial to a full thickness tear in a rotator cuff muscle and be asymptomatic, meaning they have no symptom or pain. And so this is what we would call more just like a progressive degenerative tear of that muscle, in a way that the body just compensates for and says, okay, that's happening. We can still do everything we need to do.
And I think that's really hopefully encouraging to hear, right? Like we are saying this because you might have pain and be like, but I'm not part of that group, but that's okay, because it means that you can be. We could do conservative treatment and you could have healing of the rotator cuff, but you could have also just a reduction in symptoms and back to function. And I think that's what's most important here, is that you don't have to have the surgery unless it's, you've tried the conservative treatment and it's not working.
There's varying studies that show how effective conservative treatment is. Again, this depends on a lot of things: location of the tear, severity of the tear, level of pain, level of disability, and function. The mindset that you have is also very important.
If you believe a treatment is going to work, if you go in, maybe you heard from a friend or a family member, this therapist is the best, they're going to get you better. You're going to go in with more belief that this is the therapist that's going to give you the exercises to help you heal, right? But if you go in and you've talked to someone who had surgery and they're like, physical therapy didn't work and this doesn't help, and good luck on trying it. You're going to go in with lower expectations that this is actually going to help you. And you might end up going more toward the surgical route just because of the belief you had walking into that clinic. So I think that's so important to note. That's not just what we're saying. That's literally from the studies. And so no matter what you do, if you're going to say, okay, I really would love to avoid surgery, believe that the treatment is going to help. And if you do not believe your therapist, maybe you're asking more questions, you're asking the why, and they're just not able to really give you confidence in that, you can see another physical therapist.
Get another therapist.
There's not just one, and we talk about that a lot.
If you're going to commit to the conservative route, commit. Commit full in mind, body, spirit, that yes, I trust that I can make a difference, and it will likely have some sway on your overall outcomes or progress.
Let's talk about what exercises. I think that's what everyone wants to hear, right? What exercises should I do? So, in general, we're going to be looking at trying to restore range of motion and also progressively trying to strengthen around those muscles. And so we might start really easy with just some exercises along a wall, something you can do at home where it's just like isometric holds. We're just trying to put pressure forward, trying to put pressure back, put pressure out to the side, getting all the rotator cuff muscles kind of starting to fire and work in a really controlled manner, because your arm is right by your side. You're not having to move it anywhere. That can help reduce pain. That can help just to start to build that confidence within the shoulder. Then we do want to get back to like, okay, can I start to improve my range of motion going forward, my range of motion going out to the side? And so we'll use more range of motion, mobility type exercises, along with some strengthening. We're going to do some strengthening. And this is where you're going to traditionally see just strengthening in internal and external rotation, out to your side, starting to get a little bit higher, and maybe doing some forward and side raises. But this is where we also are going to say, and there's more.
Positioning in general, and just education on how you're positioning yourself when you go to do an overhead exercise, or when you go to reach into a high cupboard to make it more functional. So things that we like to focus on are thoracic mobility. It's huge for getting the arm overhead. So important to avoid putting ourselves in potential impingement ranges of motion that we need to overwork the shoulder to try and get the same mobility as if we just extend through the upper back. So upper back extension, doing things like cat-cows that are more focused on the thoracic spine, and then upper back rotation. If we improve rotation through the upper back, we're by proxy going to also help improve our extension as well. And our body just loves to rotate. And when we reach overhead with one arm, we naturally rotate through our thoracic spine. So doing things like an open book exercise or other thread the needle type exercises that are going to help with your upper back rotation.
What else could be restricting along that area? Your pecs, right? We live in such a forward dominated world. We're on our phones, we're on our computers, our arms are forward. So can we do exercises to help relax the tension along that chest? And then starting to get that chest more mobile in its full range of motion. So not only do I love wall pec stretches, I think that feels so good to do throughout the day and to help to relax that muscle and gain that range of motion. But also when you're doing your pec exercises, like, can I go into a full range of motion push-up, getting my chest all the way to the floor? Or when I'm doing my chest press, can I make sure my arms are going all the way back on that bench so I'm opening up my chest and I'm getting that full range of motion under load? We don't understand how much strengthening in that full range plays a role in improving mobility. I think that's really important because our pecs can often take over control of what's happening. Same with our upper traps. So a lot of times people feel like they get that upper trap just kind of taking over in movement because we haven't retrained how that serratus anterior, that punching muscle, is really working with that shoulder blade. So this is like so much of what we do in the shoulder plan is really reworking that entire thoracic, pec, upper trap, serratus area around the body.
I mean, you mentioned briefly there training the serratus, which we call our punching muscle, and that it's so important for movement of our shoulder blade, which movement of our shoulder blade is vital to getting full range overhead. So there are things where you can do like on your hands and knees, doing what we call just put the plus of the push-up plus, where hands are in the ground and you just essentially push your hands and fingertips down into the ground to get those shoulder blades to glide forward. And as you do that more and more, you'll kind of train that pattern of, okay, when I reach overhead now, that serratus anterior is going to kick on and help glide that shoulder blade. And that can be super beneficial to prevent those impingement type positions. Of course, there's a ton more. Finding good core coordination, finding good expansion through our ribs. Our breath patterns can be super important so that we're not breathing with all of our accessory neck muscles and upper chest muscles that can cause more restriction, which then might cause us to compensate in how we use our rotator cuff. So of course, there's always more. Jen mentioned the shoulder plan in Gen Health. Great place to start. It's a 30-day plan that takes you through a lot of these different types of exercises that don't focus just on the shoulder, but focus fully on the complex from shoulder blade, rib cage, core, chest, upper back. It hits it all. And we briefly mentioned posture. I always talk about my 30 for 30 rule or 30 every 30 rule. If you're working or if you're going to be doing something in one position for more than 30 minutes, set a timer, especially if you're going to be working for 4 hours, 6 hours, 8 hours. Set a timer that goes off every half an hour. It can be silent. So once your phone starts buzzing, you get up and do one of the things we just talked about. Extend, rotate through your upper back, stretch your chest at the wall. Just lift your arms overhead and move in a position that you weren't just moving in and get back to work. And it doesn't have to take more than 30 seconds. But if you do that every 30 minutes, we're doing it 10 to 12 to 20 times a day. And that can be so beneficial in the way it starts to train our nervous system to feel something different and to not feel like it is always tightening down into this one position that we're holding.
Thank you so much for joining us. I hope that you learned a lot. You're excited to potentially explore the shoulder plan because even if you don't have current shoulder pain, working on all these components that we talk about can help you to prevent shoulder pain. So we're going to have the free link trial. And of course, if you have any other recommendations, let us know and subscribe so you don't miss out on any future podcasts.